Hello, Ms. Johnson. My name is Richard. I'm going to be your nurse for today. I checked the order. You actually have an NG tube insertion for today. It's basically because you're having trouble swallowing, and we want to make sure that we can do some feeding and suction if necessary. Can I get your first and last name and your birthday? Perfect. I'm going to go ahead and put this down. Actually, I'm going to get you in position first. I'm also going to check your wristband. It looks good. So I'm going to lift you up and put you straight up so we can work on the tube. Perfect. All right, so I'm going to go ahead and get my gloves on and we'll get the procedure started. All right, I'm going to go ahead and put this pen light in your nose to see which nose I want to work with, okay? Do you have any deviated symptoms or nose injuries in the past? No? Okay, your left one looks a little bit more open, so that's the one I'm going to use, okay? Alright, so I'm going to get this drape set up. I'm going to check my stuff. Okay, actually I'm going to do my tape first. I'm going to go ahead and measure, make sure that this goes into the right spot in your tummy, okay? I'm going to start at your nose, go to your ear, I'm going to go down to your xiphoid process, and a few more inches. Okay, I'm reading 60 centimeters, so I'll make sure to document that later. I'm going to go ahead and put my tape at the 60. Okay, perfect. I'm going to go ahead and leave it up, and we're going to go ahead started. So this is going to go into your nose. It's going to be uncomfortable, but it's not going to hurt, and it's going to be quick, okay? We're going to get this drape up closer to you, and we're going to go ahead and get started. Are you ready? 1, 2, 3. Can you extend your neck up to here for me? Perfect. Here we go. Alright. I passed your nasal pharynx. Can you go ahead and swallow for me? Perfect. Now, I see I'm going at my first resistance at the oropharynx. Can you go ahead and drink some water for me? Perfect. And can you swallow? Alright, I'm going to go ahead and keep going. Alright, perfect. We reached the placement side. So I'm going to go ahead and secure your tape. Actually, well, yeah, I'm going to check real quick that you haven't, it's not cold in the back. Okay, if it was cold in the back, I'd have to pull it out, but it looks like it's in a good spot, so I'm going to go ahead and proceed. Okay. Perfect. And lastly, I'm going to go ahead and make it snug so that you don't have any issues with it moving around. I'm going to put it close to your neck. I'm going to safety pin it. Okay, perfect. Now we want to make sure that the tube is actually in your stomach, so I'm going to aspirate some of your stomach fluids to make sure that the pH is in range. So I'm going to grab my piston. Grab some mucus there. Go ahead and it. I got my page strip. Okay, looks like it's at a 2, so it is in the right place. Okay, so I'm just gonna go ahead and document that it's at the 60 centimeter mark, and I do my hand hygiene, and I'm just gonna make sure that it's in place. It is secured nicely. And yeah, okay. I'm gonna put your collet in the lowest position, or your bend in the lowest position. I'm gonna document, like I said, and if you have any questions, just hit the collet. Okay, now we're going to the suction. Okay. So knock, knock, knock. Hello, Ms. Johnson, I'm back. We confirmed the x-ray. It does look like you have an order to start suction. Can you get your first, last name, and your date of birth? Perfect. I'm gonna also get your wristband. Okay, perfect. I'm gonna provide you some privacy. All right, I'm gonna go ahead and turn my suction on to intermittent at 80. All right, perfect. And yeah, so this is I'm just gonna connect the suction to your NG tube. So where's my little connector? Perfect. All right, I'm gonna go ahead and document that I've started that for you. I'm gonna put you back into your lowest position. I'm gonna give you a call light. I'm gonna take off my gloves, and I'm gonna do hand hygiene. All right, and now my final step is I'm gonna do the discontinuation of the NG tube. So here we go. Knock, knock, knock. Hello, Ms. Johnson. All right, it looks like you don't need the cleaning anymore, so we actually have an order to discontinue the tube. So I'm gonna go ahead and put my gloves on one last time. We can get you back into position. I'm gonna turn off my suction. Alright. Got in your name, got in your birthday, I've checked your wristband, you are the right patient, and I checked the order. So I'm gonna go ahead and take off the clamp. And before I take it out, I'm gonna go ahead and put the 30 milliliters of air, just to make sure that all of the content stuck in the tube or any of the feeding or anything goes back into your tummy, so I can pull it back out. Alright, so give you some privacy. And we're gonna go ahead and push. Perfect. Alright, I'm going to take the tape off. Alright, I want you to hold your breath for me when I say go, and when I do say go, we're going to pull the tube out. I'm going to try and do it at a nice rate. Alright, go ahead and hold your breath for me in 3, 2, 1. Here we go. Perfect, keep holding. Alright, perfect. I'm going to go ahead and check that the tube is intact. Yeah, the tube looks great, and I'm also going to take a look at your drainage too, so I can chart how much is in there and if everything looks good. So I'm going to chart that there's 100 milliliters in there, nothing unusual, so I'll make sure that I make a note of that. All right, Ms. Johnson, let's go ahead and get your drape off. I see you do have, actually hold on, let me take a look here. I think you could use some oral care, so I'll come by later or I'll send the CNA to clean you up. But that's pretty normal. But yeah, if you have any questions, just go ahead and hit that call line. I'll be here today until 7:30 p.m. I'm going to put you in your lowest position. I'm going to go ahead and document. And I'm going to take my gloves off and do some hand hygiene. And I'll give you your table back and you'll be all set.